Hi, I'm James.
I'm Katina, and we're connected with the Collins. Hey, y'all, it is so good to be here with you guys tonight. And we just wanted to come in and go live. Normally, we do our drop video on Fridays, but we were talking about this Women's History Month, and we thought, let's go live today, and
Something different.
yeah, something different. Before we get started with today's conversation, will you do me a favor? Will you like
And share.
and subscribe by hitting the bell down below if you think this content is good for someone else to hear?
Absolutely.
So let's get into the conversation.
Yes.
We are talking about communication this month of March, and hope you all enjoyed last week's content. And this is also Women's History Month, Women's History celebration, and very close to my heart. It's also Endometriosis Awareness Month. And everybody is not aware of what endometriosis is. But when we get into this conversation about communication, and we're not going to be on here long, when you think about endometriosis, it is a physical condition. It's really a disease that affects many women, and they don't realize that they have endometriosis. The tissue that is supposed to be on the inside of your lining is on the outside of your uterus wall. And what happens is it's almost like having ulcers, if you will, and it could be on your outside of your uterine wall. It can also be on your colon. And it's very painful. And so one of the things that we wanted to acknowledge today is communication, listening and supporting your partner. So whether you're married, whether you have a partner, whether whatever your relationships look like, your family, that it's important that you listen and support. We also wanted to talk today about when you're listening and when your partner may have reached a place where he or she needs to seek counseling, that communicating with you may not be enough, that it's important for them to reach out and to get the counseling that they need. So let's talk about this endometriosis and how that impacted our lives. So again, we've been married for 30 years. For those who are connected with the Collins, 30 years. And in that 30 years, our earlier part of our marriage, we had no idea that I had endometriosis. We knew that that the doctor said from the issues I was having, what were those issues? I was having severe pain every month when it came time to menstrual cycle. And you reminded me, I would be on a cycle for
6 months.
6 months, which also meant that we weren't able to have relations.
Right.
We weren't able to have sex, right?
Right.
And that became it could have impacted us really if we weren't able to listen and to communicate. In addition to that, again, they also said I couldn't have children. So it was 18 years before God actually opened up my womb and we were able to actually give birth to a child. And it was after the birth of our miracle that we really came in contact with the doctor who recognized that my symptoms, because I would be at work underneath my desk, I would be driving and have to pull to the side of the road. I reached some really dark places because the pain had gotten so severe. I was like, listen, if I got to deal with this, God, just take me out of here, right? I'm not going to take my own life, but Lord, take me out of here.
Yeah, you do the work.
And so, again, it was some really difficult places, and the pain would just hit. And the doctors were saying it was in my mind. But God sent a provider, actually a male provider, gynecologist, who said, you have endometriosis. And it was from that point forward that I began to be able to get some treatment for that. But I think one of the things that's really important as we think about that in that communication is talking to one another, and recognizing the fact that I needed support.
Mhm.
How did that make you feel during those times of, well, you saw me, so
Yeah, as a husband, you always are is concerned about your spouse,
hmm
and again, as men, we are fix-its. We're prone to, like, if I can just fix it for her and make it all better. But that's not. There's certain cases that is not realistic about
hmm
that. So, what I had to do is trust God in the plan, that whatever path that we're going down through, that I just have to trust God and ask God, how can I be a great support
hmm
for my wife? I know,
and no
'cause-
pressure.
right.
You didn't pressure, because the other piece with the
Hmm.
endometriosis is, even when we did try, like there was
Hmm.
sometimes when I wouldn't be on my menstruation,
Hmm.
it was very painful
Right.
to even have relations. And
Right.
so, bringing endometriosis awareness to the forefront is really important to me. What else was
I mean, yeah.
impactful for you?
What it did for me is that it showed another side of me, of what to cater to your needs, and how can I
Hmm
help you make your comfort, keep you from going too far to the left, and because you talk about that dark place.
Yeah.
And I know, you know the having a great support in your life, that from your spouse, it can really, not only it'll draw you guys in closer, but
hmm
what it would happen is, we can hold each other in those
hmm
moments, those sensitive moments,
Yeah.
and really, like, nah, I can't bear your pain,
Right.
but I'm there with you.
Yeah.
I'm there to help you. Your
Yeah.
aid. What can I do? You tell me what
hmm
what you need, and I will do my best to support that.
And that
And
was that
so,
communication piece. I mean,
well,
it was so
I
important.
mean, so if it means for me to go without it, for the sake of your mental, and
hmm
listen, I'm gonna do what's necessary, because beyond the other stuff that's superficial sometimes, you are the most important
Yeah.
thing. And it goes back to the vows that we made,
Right.
for better, for worse,
hmm
for sickness and health.
hmm
And so, and that's what that means when you commit those vows, and in your ways. What life will bring you to the point of,
hmm
you're going to have to honor those vows.
It's true.
And so,
And
mhm,
communication, right?
and
So communication
communicating.
was really key. And I
Yeah.
think, the other thing, as I thought about the endometriosis and the amount of pain,
Hmm.
that we would suffer through, there was, and you have to also learn how to listen and hear
Hmm.
when the other person isn't saying anything verbally,
Yeah.
but everything physical,
Talk about it.
exactly what they're saying. And so,
Hmm.
so tonight, or today, whenever you are watching this particular um, uh, conversation, we want to encourage, one,
Hmm.
any woman that is experiencing pain, and the way that I could describe it, to anyone that I was talking to, is, when you're going into an endometriosis flare up.
Yeah.
Again, you don't know when it's going to happen, but it is debilitating.
Hmm.
That pain grips you so
Hmm.
till you cannot function.
Yeah.
Your mind, everything
Hmm.
in that pain. And the only thing that I can help you understand or correlate it to is being in labor.
Mm.
When that endometriosis flare up happens, it's like being in labor, and nothing will take away that pain
Yeah.
until it goes
Yeah.
away. It's like having, it's like you're having back to back to back spasms, right?
Mm.
And if you have this tissue, in your colon, which I do, then you end up having rectal spasms. You have uterine spasms. So the pain is all over, and so glory be to God that
Lord.
we're
Mm.
able to be in the position that we are now. But the other place, again, so for any woman that is experiencing that you're not crazy, like they wanted me to think I was. If you're experiencing that level of pain, I encourage you to get connected with the GYN, a gynecologist that is familiar, that understands
Yeah.
endometriosis.
And now what I'll say too is, if you're not happy with the results,
Yeah.
get a second opinion,
Hmm.
a third opinion, because this is your body. And
Yeah.
so uh, ain't nobody, they're not gonna know
Mm-mm.
sometimes unless you make them respect what you're saying
Yeah.
about your body.
Yeah.
You know, you're, like you said, you're not crazy.
No.
It's not all in your head.
Mm-mm.
It's happening for, you know, your body is, you're feeling these pains because something is wrong there.
Yes.
And so and you talked about being in that dark place.
Yeah.
You know, just to encourage you guys, it is treatable. You
It
know,
is.
it is. There is, and so we're talking about 30 years ago, but I bet you with today's technology and the research and development out there, to where the transition of getting help is probably much more smoother
Mm-hmm.
than it is where when we
Well,
first
right, because Janae is
got.
now 11.
She's now 11. Mhm.
So it has to be better than what it was 11,
Yeah,
12 years
you know,
ago.
yeah. Well, we're,
Right.
even about with Jasmine, that's
Right.
that's
Yeah.
really was
The
the
beginning.
genesis of that.
Hmm.
And so really is just don't take no for an answer.
Yeah.
If you want to get to the bottom line and want to know what's going on, get a second or third opinion. And
Hmm.
that we've been taught that
Yeah.
through our forefathers. And because technically, I mean, they're not feeling your pain, you are.
No.
So is you got to do the homework. You got to
You
do
have
what's
to.
necessary
Hmm.
to get the kind of help. Yeah.
And support one another, right? So
Yeah.
support, and so again, bringing awareness to endometriosis this month, again, Women's History Month, and it's also Brain Injury
Mm.
Awareness Month.
Okay.
And oftentimes when we think about a brain injury, it's not always just in the physical, where it's a person has experienced a trauma
Mhm.
to their brain physically. But I also want to acknowledge today those who have experienced this trauma in their life,
Mm.
have had multiple, having multiple back to back to back losses, whatever that
Mhm.
is traumatic, and
Yeah.
and it can cause brain injury, it can cause anxiety, it can cause a number of things. And so watch and listen to your spouse or to your partner.
Yeah.
And if you identify that, you need to get some help, you need to sit down and talk to a professional. You need to talk to a counselor, a psychologist. Encourage your partner to do that. It's one thing because, as your partner, you should be your partner's best friend. But sometimes your partner needs to share some feelings about you
Yeah.
to somebody else. Support that.
Mhm.
Encourage them to do that,
Yeah.
because it doesn't take anything away from them.
No.
It actually will make them better. So,
And then let me say this too. I'm glad you brought that up, because a lot of times, especially in the African American community, we'll quick to say, if you got to go see a shrink or whatever you want to call them, that means that you're crazy. You are not crazy,
mm-mm,
because the reality is that we all go through something. There
mm-hmm.
has been a crossroad experience
Yes.
in our lives, to where that there's time stamped in our head
Mm-hmm.
about things we'll never forget, whether it's on the positive or
That's
negative
true.
side. And so sometimes, if you don't deal with the residue of
Mm-hmm.
yesterday, it can come bite to bite you
Mm-hmm.
in these day and time, because it could be something that triggers that emotion that
Mm-hmm.
come out of nowhere,
That's true.
and it causes depression, and then
Mm-hmm.
and then your spouse is like, what is happening? Because believe it or not, our spouses can sense each other
Mm-hmm.
as when there's a change. And so I would admonish you to just to be open, stay
Mm-hmm.
open, be open for help, for
Yeah.
change. If you want change, you have to go to the place to get change.
Yes.
And so sometimes, we was taught to always to internally rationalize it, or
Mm-hmm.
work it out yourself, especially as men. Oh, you can fix it yourself, but the honesty is, we cannot.
Right.
And so that's the first start. The second start is admitting that you need help,
Mm-hmm.
and then thirdly is having that key person in your life that will listen
Mm-hmm.
to it,
And the
because
courage to step out
and the courage to
and go
step
do
out.
it. Mm-hmm.
Yeah. And so I again, you talking about brain injuries, but there's some mental injuries that's been happening to us,
Mm-hmm.
whether it's from the family, whether it's residue from job to job,
Mm-hmm.
there's psychosis or things that we grow to fear over time
Mm-hmm.
that brings on anxiety,
It's true.
I
Having
mean,
a child that was on drugs and
yeah.
alcohol,
Hmm.
dealing with her own mental health, that
Absolutely.
affects you. It affects you.
Yeah,
Mm-hmm.
and and just face it, the time and age that we're in, the pandemic,
Mm-hmm.
you see the homeless rates is
Mm-hmm.
skyrocketed. You see the I would call them like the end times where we, there's yet wars are still happening, and so that alone is enough to make anybody depressed,
Mm.
especially if you have
That's true.
or know somebody that has to go. Someone might be worried about their children's and everything like that. So I would admonish you to seek help, seek counseling, seek guidance, and deal with it.
Yeah, yeah. So that's our communication conversation
Yes.
today is uh let's talk,
Hmm.
listen,
Yes.
communicate.
Yes.
Communicate not just with your spouse, but if that means communicating with someone outside. So seek professional help, whether it's a medical professional or a mental health professional.
Mm,
This month, talking about communication, seek the help that you need so you can get better,
absolutely.
right? Because there is better on the other side.
Thank you.
All right. This is Connecting with the Collins. If you've got a comment or if you got a question that you would like to submit, please use the chat and send us a comment. We would love to hear from you. And like we always say, it is our foundation
Hmm.
is faith. Love is always wrapped around this family. And you as our connecting with the Collins family, we love and we appreciate you,
Yeah.
and we hope that you will share this with someone else who might enjoy this content.
Yeah.
And for those who you may know someone that is struggling with pain in their body or struggling with mental health, support them through it because you don't know when it might be your turn. All right. Have a wonderful morning, afternoon, or evening.